Hey, what's up, guys? So today we're going to be talking about the femoral triangle. It's a very important landmark in the body, and within the femoral triangle we have our femoral sheath, and then within the femoral sheath we have our femoral canal. This is very, very important because we can have hernias through there, and it supplies all the blood flow going down to our lower extremity. So let's get into it. So the femoral triangle's borders, it has a superior border, which is going to be inguinal ligament or Popart's ligament. The lateral border is going to be the Sartorius muscle, and then the medial border will be the adductor longus muscle. The adductor longus muscle also makes part of the floor, along with the iliopsoas muscle and the pectineus muscle. The roof of the femoral triangle will be fascia lata, and it may include the cribriform fascia. But this is not as important as knowing what the superior, lateral, and medial borders are, because we have to identify our structures. All the structures that we're going to be talking about today are from lateral to medial in that order. So let's get into it. So our first and most lateral part of this femoral triangle and structure in this femoral triangle is our LeBron James nerve. If you haven't seen our video, watch it above. So it's our lateral femoral cutaneous nerve. It's our L2, L3 nerve, which is our LeBron James nerve. We also have our femoral nerve, which is L2, L3, L4, and they're both coming off of that lumbar plexus, where we have a mnemonic, I twice get laid on Fridays. We have our artery, our profundus femoris artery. It's also called the deep femoral artery. I didn't like my handwriting there, so deep femoral artery, and it gives two branches, medial and lateral femoral circumflex arteries. They both will track laterally, and then the medial circumflex artery will wrap back around and go medially. So these are structures outside of the femoral sheath. So then we're going to have our femoral sheath, which is to prevent impingement, and it's a sheath, so it allows the structures to glide effortlessly with both flexion and extension of the hip, because it's a big pivotal joint. So NAVeL is going to be our mnemonic. So NAVeL for nerve, artery, vein, empty space, and lymphatics, from lateral to medial as well. Okay, so once again, it prevents impingement. So our first nerve of the NAVeL structures is our genitofemoral nerve. It's 1, 2, kicking the nuts, L1, L2, comes off the lumbar plexus as well. We have our femoral artery and our femoral vein. They run very similarly. And then you have our empty space, but that's called our femoral canal. It functions to allow the expansion of the femoral vein, and it's extremely important. The femoral ring, which is a superior portion of the femoral canal, is a weak area of the abdominal wall where femoral hernias can occur. And then our last letter of this mnemonic is lymphatics, NAVeL. Lymphatics is at the end, it's most medial. All right. So nerve, artery, vein, empty space, lymphatics. And the empty space is the femoral canal within the femoral sheath. All right, so let's look at our borders real quick. So our sartorius muscle here is, once again, our lateral border. Then we have our adductor, adductor longus muscle as our medial border. And then our inguinal ligament is the superior border. Our iliopsoas and pectineus muscle. And once again, our adductor longus muscle makes up that floor as well. The cribriform fascia will be making up the superficial, or the top of the border. So let's add in our structures. So we're out here on the side, we have our lateral femoral cutaneous nerve. It's a little bit outside of the triangle, but every body's a little bit different anatomically. Then we have our femoral nerve. And just underneath the femoral nerve, we have our profundus femoris artery, or our deep femoral artery, depending on what you want to call it. And it has two branches, remember, our lateral and medial femoral circumflex, which will both go laterally, and then the medial one will turn back around and go medially. All right. Now we have our femoral sheath. Remember, our femoral sheath is to prevent impingement. All right. And so we're going to add our vein in here. And remember what our mnemonic is NAVeL. So it's nerve, artery, vein, empty space, lymphatics, from lateral to medial. So we have our genitofemoral nerve, L1 and L2, kicking the nuts, femoral artery, femoral vein. And then that empty space is going to allow the vein to swell up and to be able to expand. Veins have a lot of blood coming up and get out of the body, and to go from the lower extremity back up to the upper extremity. And then we have our lymphatics, so that's the green that you see there. So once again, NAVeL is nerve, artery, vein, empty space, which is the femoral canal, and then lymphatics. Let's put together our puzzle, okay? So our superior border is the pulparts ligament, our lateral border is Sartorius muscle, and our medial border is the adductor longus muscle. We have our lateral femoral cutaneous nerve, which is our LeBron James nerve, L1 or L2, L3, our femoral nerve, L2, L3, L4, and then our deep femoral artery, which is our medial lateral circumflex. Then we have our femoral sheath, which is going to be able to prevent impingement of these important vessels. And it has our genitofemoral nerve, which is L1, L2, kicking the nuts, femoral artery, and femoral vein. Our empty space, which allows the swelling or allows the vein to expand. And then our lymphatics. All right, guys, if you guys have any questions or want any more mnemonics, please subscribe and let me know. Thanks.